Hello, good morning, how are you? Today's our topic is ear. Do you know which cranial nerve involved in hearing and balancing? It's eighth cranial nerve, also known as vestibulocochlear nerve. Vestibulocochlear nerve consists of vestibular and cochlear nerve, in which vestibular nerve help in balancing the body and cochlear nerve help in hearing process. Ear mainly have three parts: outer, middle and inner, in which outer ear consists of pinna, auditory canal and tympanic membrane, and in middle ear it consists of auditory ossicles and eustachian tube, and inner ear consists of cochlea, vestibular nerve and semicircular canal. Inner ear consists of two membranes. Outer layer is bony labyrinth and inner membrane is membranous labyrinth, and in between there is a serum present called perilymph which is rich in sodium, and in membranous labyrinth there is also a serum present called endolymph which is rich in potassium. As you can see from this diagram, outer layer is bony labyrinth and inner layer is membranous labyrinth, and in between there is a serum present called perilymph which is rich in sodium, and in membranous labyrinth there is a serum present called endolymph which is rich in potassium. Process of hearing. When the sound wave strike on the tympanic membrane which is collected by the auditory canal, it will cause the eardrum of the middle ear start vibrating. Initially, malleus start vibrating because it attached to the tympanic membrane. Then the vibration transfer from the malleus to the other bones of the eardrums. At last, stapes transfer the vibration to the cochlea which contain fluid, perilymph and endolymph. There are some important signs and symptoms of middle ear disorder. First is ear pain, fullness in the ear, feeling of general illness, nasal congestion, cough, lethargy, vomiting and diarrhea. And signs and symptoms of inner ear disorders are balance problem, vertigo, dizziness, hearing issue, nausea and vomiting, a feeling of fullness in your ear, ringing in your ear, tinnitus and headache. Here are some important questions which generally asked in NCLEX examination. A client is diagnosed with a disorder involving the inner ear. Which is the most common complaint associated with disorder involving this part of the ear? First is pruritus, second is tinnitus, third is hearing loss and fourth is burning in the ear. You have 10 seconds to write answer in the comment box. And the answer is B, tinnitus. And the reason behind is the hair inside your inner ear are bent or broken. This happens as you age or when you are regularly exposed to the loud sound. They can leak random electrical impulse to your brain causing tinnitus. If your answer is hearing loss, then it is incorrect in case of inner ear because it is the hallmark sign of middle ear disorder. For example, perforation of tympanic membrane.